Hi, I'm Dr. Kimberly Hildner. I'm one of the OBGYNs at South Denver OBGYN and Midwives, and we work out of Littleton and Castle Rock. So I went to University of Notre Dame for undergrad. For medical school, I went to Loyola in Chicago, so I went to their Stritch School of Medicine. For residency, I went to University of North Carolina's Southeastern Area Health Education Center in Wilmington, North Carolina. So I grew up around a lot of doctors and nurses. Like, my dad was a doctor, my grandpa was a doctor, my grandma was a nurse. I have an aunt who's a physical therapist. And when we were really young, I remember going on rounds with my dad. He would take us by the labor and delivery unit so we could look at the babies and stuff, actually. I just always loved it. I was not one of those people that didn't like hospitals. I think what I like the most about being an OBGYN is that it's so variable. You get to have all of those office interactions with patients in kind of a low-key setting and get to know maybe them and also maybe their mom and their sister and their daughter and all of that. So you do have that continuity of care. And then you get to go to the OR and be a little bit more technical. And then labor and delivery is a very fast-paced place. You know, you're birthing someone's baby, so that is something that they'll always remember. And it is really rewarding to kind of be the one to tell them that they're pregnant, tell them what they're having, sort of measure how the baby's growing, take the little pictures of their profiles while they're still inside, and then also be the one to deliver that baby and see them at their postpartum appointment and stuff like that. So it's a cool journey to be on with them. So my philosophy of care for OB and GYN is a preventative approach. So for example, in obstetrics, I have seen many pregnant women go through all 40 weeks. And so I can sort of anticipate when the nausea will be so bad or when the common discomforts of pregnancy will kind of start bothering them a little bit more. And so I like to get on top of those subjects a couple of weeks before I anticipate them coming so that they already have some tools in their tool belt to kind of relieve that symptom or pain or whatever it is. So in our office, we offer something called Biot, which is a hormone replacement option. We have a lot of patients that sort of start to feel perimenopausal symptoms, menopausal symptoms, and are not getting relief from whatever over-the-counter type of thing that they're trying. So when they come to our office, we'll sort of go through what exactly is bothering them, and then maybe do some hormone testing to see where they are in this perimenopausal transition, and then offer them different things based on their symptoms and their lab results. So sometimes it's just a pill, sometimes it's a patch, sometimes it's a cream or a gel, but other times it will offer the Biot pellet therapy. So I grew up coming to Colorado to ski and to hike and to backpack, and I just loved it. And so I continued to visit on my own when I was in med school and college and stuff. So once I graduated residency, I found a job out here and found a rental house and got the dog I always wanted. And so now I can ski and I can backpack and I can camp and I can paddleboard and I can do all the things I wanted out of the state. But now I can also do it with my cute dog and my cute fiance and all of our friends.